Hi, my name is Chelsea, and this is the video for the IV fluid and also for the medication. I'm just going to lift everything up that I have here, all my supplies. First thing I'm going to do is introduce myself, let the patient know who I am, make sure that I maintain privacy, whether that's closing the door or closing the curtain, whatever the patient's comfortable with. Come in, make sure that I do my hand hygiene. Go ahead and put my gloves on, and then I will go over with you guys what supplies I have and what I'll be doing today. And this is what I would do with my patient, just let them know what I'm doing. So I want to verify first that I do have the correct patient in front of me. That's part of the 5 rights for medication administration. Want to make sure that I verify first and last name, date of birth, and then usually if the patient has like an ID band on, that's how we can verify with them. We do want to make sure that we have the right medication, that it's the right route, that we're giving it at the right time, and also we want to do the right documentation as well. And then let me just go over my supplies here really quick. So I have my primary one here, and it shows on here the drop factor as well. So I have my primary bag. This is the normal saline. I have my IV tubing here. This is the spike right here. This is the chamber. Here's my clamp so I can control the drop factor. Right here is the Y tubing, where we can also administer medication as well while we're running fluids. And then right here is the N, or the adapter, where we would hook up the IV. All right. I also have this tool right here. It's just to help hang the piggyback or the medication bag. I have that here as well. Here's the little bag. And right here you can see that this is the secondary set. The tubing that goes along with it has the spike, the chamber, the clamp, and then right here the little port. And then I have some alcohol swabs here as well to clean. Okay, so first thing that I'm gonna do here, already verified the patient, make sure that there's no allergies. I know right now I'm just doing the fluids, but it's always good just to practice that for safety reasons, to review, to make sure that the patient doesn't have any allergies. So grab, and I have a bin down here. I know you can't see it, but it's where I'm going to be priming to ensure that there is no air. So I'm gonna go ahead and remove the top here. I'm gonna place that spike in. And I do have everything clamped as of right now. We just want to fill it about either halfway or a quarter. And I am going to prime this because we don't want any air being injected into the patient. So I'm going to go ahead and just get the cap off there. We want to make sure that we hang this about 30 inches above the patient. So I'm just going to put that right there. I don't have an IV pole. And I'm just going to get ready to prime here. Make sure that it's coming out. There we go, perfect. So I'm checking the integrity of everything too. I don't believe I mentioned that, but just to ensure that it's the right expiration date and everything, make sure that it doesn't look cloudy and the integrity is good there. So now I'm going to be checking for, and I'm just going to show you here. I did write it down here. So don't know if you could see it, but I'll go over it. So for the fluid portion, it's 150 mils per hour. So the way that you would do the calculations is you would take the 150 mils, multiply it by the drop factor, which is 15 drops, and then over the course of an hour, which gave us 37.5. We can't use halves, so we're gonna round that up to 38 drops. So now what I'm gonna do is I am going to adjust the clamp, and I'm gonna do this for 1 minute, and we're gonna do the 38 drops for 1 minute. So I'm gonna go ahead and do that and just watch it. Okay, so at a minute, I do have it at the 38 drops. So now I'm gonna move on to the second portion. And I'm just gonna prep this really quick, like I said, because I don't have the IV pole here. So I'm just gonna stick this on here. And this is how I'm gonna be able to ensure that the medication bag is above my primary one, which is very important because we want to make sure that the medication goes through first. So the doctor's order for this is give amoxicillin 250 milligrams through the IV in 100 ml normal saline over 15 minutes. So the way that we're going to do that is it's 100 mil, and then we're going to multiply it by the 15 drops over 15 minutes, which gives us 100 mils there. So again, I know I kind of brought this up at the beginning of the video, but it's really important that we ensure that we verify for allergies. We don't want any reactions to the medication, so super important. Verifying with the patient once again and going over making sure it's the right route, right medication, right time, right dose. So let me go ahead and remove this. Have my spike here. You just want to get about a quarter or halfway through. There we go. Really important when we're priming, we don't want to get rid of too much of this aspect because it's the medication. We want to ensure that the patient gets the right dose, but we do need to prime. Make sure that there's no air bubbles here. So I have my clamp. Don't believe mine will reach, so I'm gonna actually have to do it right here as if it were above. Just ensuring that there is no air bubbles there. Beautiful, everything looks good. Gonna put the cap back on for just a moment because I'm gonna need to wipe down the Y port, which is where we are going to attach that part so that we can administer the medication. So I have my alcohol swab right here. I'm gonna clean that port. I already lowered this, so I'm gonna put this right up here. Ensuring that I'm not contaminating it since I did just clean it. I'm gonna go ahead and attach that Y port. And now we're gonna do the same thing that I did with the normal saline bag. We wanna make sure that it's the correct amount. So we have to time it again for 1 minute, and I did say 100 mLs. Okay, all right. So I'm gonna use the clamp, time it, and adjust the clamp as I go if needed. We're doing this for 1 minute. And I see the drops going, so everything looks good, integrity looks good, medication looked good. All right, and while I'm wrapping up and getting close to my minute mark, I can also check with the patient, ask how does it feel, how are you doing, and kind of multitasking a little bit just to kind of keep things going. Make sure that the IV has not infiltrated, that the patient's not experiencing any discomfort. Sometimes patients come in and don't have allergies to anything. I've experienced that, and it can happen for the first time when you do give it to them. So I just want to also check and make sure that they're breathing well. They're not, like I said, feeling any discomfort at the site, but also checking, like I said, yeah, airway, and then making sure that they're speaking in complete sentences and things like that. And then I would go ahead and remove my gloves, perform the hand hygiene again, ask if there's any questions before I step out. And like I said, I ensure that the patient was safe while they were receiving the IV initially for the first few minutes, and then either close the door or the curtain behind me and ensure that the call light is there if they do need anything. And that's it for this video. Thank you.